What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are, and however you might be listening to me today. Thank you so much for taking the time. And folks, every single week, me and my company, Christian Brindle Insurance Services, bring you a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, today I'm going to bring you the new donut hole numbers, the new coverage gap numbers for 2022. So I'm really excited about this. This is episode 261. I hope that you enjoy it. And so let's just jump right into it. There's not a whole lot of changes for next year. So to refresh, for those of you who might not be aware, in the Medicare world, you typically have stages of drug coverage, right? This doesn't matter if you get an individual Part D prescription drug plan or if you get a Medicare Advantage plan that includes Part D prescription drug coverage. It's going to come through stages, right? Different stages of drug coverage. The first stage is going to be what's known as your annual deductible if the plan has a deductible. And it might only apply to certain tiers, right? It might apply to tiers 3, 4, and 5, meaning your brand name tiers. Tiers 1 and 2 are going to be your generic tiers. It might apply to all tiers. It might apply to tiers 4 and 5 only. It just kind of depends on the certain plan. But if the plan has a deductible, that is the first stage of meeting that deductible. It could be $200 a year, $300, $400, and it looks like the maximum deductible limit of 2022 is going to be $480, which is a jump from what it was in 2021. The second stage is going to be what's known as the initial coverage stage. The initial coverage stage, essentially what that means is you pay a copay, right? So if your plan, let's say, has a $40 copay for a tier 3 prescription for a 30-day supply, you pay the copay, they pay the rest. Easy peasy. If it's $10 for a tier 2, you pay the $10. If it's $2 for a tier 1, you pay the $2. You pay your copay, it's a set copay, and you're done. Unless it's a tier 5, of course. Tier 5s typically are going to have a percentage, usually about 25% going into 2022 from what I have seen. So that's your initial coverage stage. The third stage is going to be what's known as the coverage gap, also known as the donut hole. And so the donut hole is a little bit more complex for most people to understand. Now, this resets every single calendar year. So on December 31st, starting January 1st, this all starts over, and it changes a little bit. The coverage gap and the donut hole numbers for 2022 are going to be $4,430, which isn't a dramatic change from what it was 2021. It's about $4,100-ish, in the ballpark of about $4,100. What this means is once the total cost of your prescriptions equals $4,430 over the course of the year, then you enter what's known as the coverage gap or the donut hole. The total cost meaning what you pay for your copays as well as what the insurance company pays out in claims, the total cost. So for example, if there is a $300 prescription and your copay is $30 and the insurance company is covering the rest of the $270, for example, the total cost, what you paid plus what they paid, the $300, is what goes towards this $4,430 number of getting you to the coverage gap or the donut hole. Some people will never get there. Some people's drug costs just aren't high enough over the course of the year, but a lot of people it is. And it's a terrible, awful, evil government program, in my opinion. But once you enter this third stage of coverage, the donut hole, then you start paying about 25% of the cost of any prescription. So your costs are essentially going to go up, right? So in that scenario, let's just say there's a $300 medication. Your coverage in the initial coverage stage was, let's say, for example, $30 for the sake of example, and that was your set copay. Well, the difference would be you'd then be paying 25% of that $300 instead of the set copay. Your costs would go to about $75 instead. So your costs go up in most cases. The final stage of Medicare Part D prescription drug coverage is what's known as catastrophic coverage. So catastrophic coverage is once you pay an out-of-pocket cost of $7,050 for 2022, you enter this final stage. So whereas to get you into the coverage gap, it's the total cost, but to get you out of it, it's your cost alone is $7,050. Once you enter this final catastrophic stage, then you pay the greater of either $3.95 copay for generic and $9.85 for other prescriptions, or 5% of the cost, whichever one is higher. So then your coverage improves, but you essentially have to go through a lot to get there. Everybody wants to go to heaven, but not everybody wants to die. So not a huge difference. Very, very small change. That's why we didn't bring this to you sooner. Very, very insignificant change in my opinion. It doesn't really impact much. Not much shaking going on. Like last annual election period, we had that change notice of the Insulin Senior Savings Program that capped a lot of insulins at $35 for a 30-day supply, whether you were in the coverage gap, whether you weren't, whether you met your deductible, whether you hadn't. And essentially, we don't have any big change like that for next year, just a very small change to the coverage gap. It raised it's essentially a positive change, I would say, because anytime you see that number for the coverage gap go up from, let's say, 4,100 to 4,430, whatever the case might be, it just means that the total, it takes a little bit longer for you to get into it, essentially. However, with inflation and the cost of everything going up, it might just kind of be keeping up with inflation, so you might not notice much of a difference. But anyway, folks, those are your coverage gap donut hole numbers for 2022. We'll be bringing you more updates, more changes shortly as they come available. And thanks so much for watching this. If you liked it, if you found it helpful, if this answered your question, like it on YouTube if you're watching on YouTube. It helps so much with the YouTube algorithm. Give us a 5-star review on the podcast platform you're listening to us on. And we'll be back next week, next Monday, with another episode. Until next time, happy Medicaring.